Hello, my name is Dr. Dewan S. Raja. Today I will discuss about diabetes and pregnancy with emphasis on gestational diabetes mellitus. Pregnancy can be complicated by diabetes in one of two settings when women with pre-existing diabetes become pregnant. That is pre-gestational or overt diabetes, or women who were previously euglycemic develop impaired glucose tolerance and the diabetes for the first time during pregnancy. We call it gestational diabetes. Pregnancy is a diabetogenic state in which the prevailing hormonal milieu favors insulin resistance. In a previously euglycemic woman who is otherwise susceptible due to concurrent genetic and environmental factor, the consequence may be gestational diabetes. Women with pre-gestational diabetes have an increased risk of stillbirth and congenital malformation in the fetus. Diabetes that arises later in pregnancy, regardless of prior history, can lead to excessive birth weight in the newborn. That is called macrosomia, big baby, and may have long-term sequelae for the child later in life, including an increased risk of obesity and diabetes. Gestational diabetes typically resolves following the delivery of the baby. However, the majority of affected women develop overt diabetes over the next 10 to 20 years. Okay. Gestational diabetes mellitus. Gestational diabetes mellitus is a type of diabetes that develops during pregnancy, especially during second or third trimester of pregnancy. It is characterized by elevated blood sugar level and is diagnosed in women who did not have diabetes before becoming pregnant. Gestational diabetes mellitus occurs when the body cannot produce enough insulin to meet the increased need during pregnancy. Approximately 5 to 9% pregnancies occurring in the United States are complicated by hyperglycemia, and the incidence of both pre-gestational and gestational diabetes is increasing in the general population. Etiology of gestational diabetes mellitus. The exact cause of gestational diabetes mellitus is not known, but it is believed to be linked to the following factors. Like insulin resistance. During pregnancy, there is some source of insulin resistance at the receptors for the insulin in the target tissues like that of skeletal muscle, liver, and adipose tissue. Beta cell dysfunction. The islets of Langerhans has beta cell that produce insulin that may not produce sufficient amount of insulin during pregnancy. Genetic predisposition. Hormonal changes. A lot of hormone arises from the placenta, like human placental lactogen, estrogen, progesterone, and also there is increased secretion of prolactin from the anterior pituitary. Family history of gestational diabetes mellitus, history of previous gestational diabetes mellitus, obesity, and lifestyle factors. People have sedentary habits. They are more prone to develop gestational diabetes mellitus. Okay, so placenta, source of a lot of placenta is the site of production of many hormones like human placental lactogen, prolactin from anterior pituitary, growth hormone from anterior pituitary, progesterone from the corpus luteum, and from the beta cells of the islets of Langerhans, we have the insulin. So there will be development of insulin resistance during pregnancy, and there will not be enough insulin from the beta cell to meet the demand of pregnancy and the developing fetus. So best way to diagnose gestational diabetes is the assessment of blood sugar level and glucose tolerance test. Risk factors. Women with certain risk factors are more likely to develop gestational diabetes mellitus. These include being overweight, having a family history of diabetes, being over the age of 25, history of multiple pregnancy, and belonging to certain ethnic groups such as African American, Hispanic, Native American, or Asian. Screening and diagnosis. Pregnant women are typically screened for gestational diabetes mellitus between 24 to 28 weeks of pregnancy. Because gestational diabetes mellitus is manifested during second and third trimester of pregnancy, this is done through an oral glucose tolerance test where the woman drinks a sugary solution and the blood sugar levels are measured at intervals. Complications of gestational diabetes mellitus. Complication for the mother. Gestational diabetes mellitus increases the risk of complication for both mother and the baby. Mothers with gestational diabetes mellitus are at higher risk of developing high blood pressure and preeclampsia. They are also more likely to require a cesarean section. Because the baby is very large, that baby may not negotiate through the normal birth canal. So it needs cesarean section or C-section. Complication for the babies born to mother with gestational diabetes mellitus may be larger than average. We call it macrosomia, increasing the risk of complication during delivery. They are also at high risk of low blood sugar hypoglycemia after birth. Okay, because the placenta is stimulated by the maternal hormones to produce more insulin. So once the baby is born, placental support is lost, then because of the pancreas, once the placenta is lost after delivery of the baby, pancreas is not getting support from the placenta, so the newborn baby cannot produce sufficient amount of insulin, and that may lead to hypoglycemia after birth. Additionally, they may be at increased risk of developing obesity and type 2 diabetes later in life. So this baby who born of mom with gestational diabetes mellitus eventually develop obesity and type 2 diabetes, but initially hypoglycemia immediately after birth. Management and treatment. Controlling blood sugar level is crucial in managing gestational diabetes mellitus. This often involves dietary changes, regular physical activity, and in some cases medication or insulin therapy. Medication may be glyburide, but it should be under doctor's supervision all the time, both the medication as well as insulin therapy. Regarding medication, there is some little risk of congenital malformation. Monitoring blood sugar level regularly is an essential part of management plan. Postpartum monitoring. After giving birth, women who had gestational diabetes mellitus should continue monitoring their blood sugar level. They are at an increased risk of developing type 2 diabetes later in life, and regular checkups are important for early detection and management. Prevention of gestational diabetes mellitus. Maintaining a healthy lifestyle before and during pregnancy help reduce the risk of developing gestational diabetes mellitus. Exercise with tolerable level is also very essential and advisable during pregnancy. This includes maintaining a healthy weight, eating a balanced diet, and engaging in regular physical activity. And that's all about the gestational diabetes mellitus as well as diabetes and pregnancy. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful and blessed day. Bye now.